If I am diagnosed with diabetes, how would the doctor go about treating me? What kind of medication would I need to take? And what are the side effects of these treatments?
Diet and exercise remains the cornerstone of therapy for every diabetic. Now, it's always a step ladder pattern. Now, metformin is the base drug which we give patients, all the patients with diabetics. Now, when metformin fails, the recommendation is that you can add any of the other oral agents when metformin fail. Now, which drug to add after metformin fail, or whether the patient needs to be added, there is a huge array of drugs one can use. From drugs which can stimulate your pancreas when required, which are called smart drugs, or which we call a DPP-4 inhibitors, to drugs which have been there for last 3 to 4 decades, which are called as the sulfonylureas, which kind of stimulate the pancreas continuously, to insulin sensitizers like pioglitazone, which only helps in the sensitivity of insulin, to drugs which act only at the level of the gastrointestinal system, which is called the alpha glucosidase inhibitors, to another group of drugs called meglitinides, which stimulate the insulin production for a shorter period of time. Then we go to the insulins. We have various kinds of insulin. We have human insulins, we have short-acting insulins, intermediate-acting insulin, we have short-acting insulin analogs, we have long-acting insulin analogs, we have pre-mixed insulin, we have pre-mixed analogs. And the latest form of therapy, which is called GLP-1 analogs, which can help in weight reduction and better glycemic control early on in diabetes. So, which drug to choose is a huge, there is no kind of a logarithm on it. It has to be assessed individually. The doctor will have to take into consideration your weight, your duration of diabetes, what complications you have, what are the complications you are prone to, what are the complications in your family, and then make a choice out of all these treatments available. And believe me, your doctor does the best job by treating you to the best possible way he can. One needs to understand that all the drugs which are available across the globe today have undergone a lot of clinical trials and testings. Each drug which has an effect will have some form of side effects, but none of them are life-threatening. The side effects are very well mentioned in the literature of the drug. The side effects and the drug interactions are very well known to the doctors who are prescribing it. So each drug would have certain side effects, would have certain allergic reactions which is purely individually based. So not taking a drug because of any side effect or because it may give you some side effects is being extremely foolish, and most of the drugs have been tested for a long period of time and for decades. So there's no harm in taking drugs. There's a huge misconception in patients that probably oral anti-diabetic drugs cause kidney problems and things like that. There's absolutely no truth. These are all myths and misconceptions. They are very well tested, globally tested for many decades.